IVRT and IVPT, these are the two very important terms in the topical product development. So whenever you are working onto the topical formulations like creams, gels, ointments, and many others, you need to understand about the IVRT and IVPT. This video is an introduction to the in vitro release test, that is IVRT, and in vitro permeation test, that is IVPT, for the performance of the topical formulations. I welcome all the viewers to this short video, and in this video you will learn regarding IVRT, IVPT and their differences. Topical formulations are evaluated by in vitro models, and the key tools for their evaluation are the IVRT test and the IVPT test. In vitro release test is to study the release from the formulation, and in vitro permeation test is to study the permeation. Then both provide different but complementary information about the formulation performance. It is not like that if the formulation passes the IVRT test, it will pass the IVPT, or if it is passing IVPT, it will pass IVRT. For some of the formulations, you need to perform IVRT only, and some of the formulations both are required to be performed. So IVRT, it is a in vitro release test, and its purpose is to measure the drug release from the formulation over time. Drug release from the formulation matrix and the rate of release is studied through the IVRT test. Synthetic membranes, non-biological membranes are used for the IVRT, and data is collected for the rate and extent of the release. So it is a quality control test and a formulation optimization test also. It compares formulations and ensures the batch to batch consistency. Limitation of IVRT is that it does not predict the skin permeation or penetration, but it studies the release of the API from the formulation. IVPT is different from the IVRT. It is a in vitro permeation test, and its aim and objective is to measure the drug permeating through the skin over time. It focuses on the skin permeation and systemic absorption potential. It is also an in vitro test like IVRT, and membrane, it is the human or animal skin or validated artificial membrane. Data collection is done for the rate and extent of permeation, and it predicts the in vivo bioavailability. So IVRT is the release test, while the IVPT is the permeation or penetration test. It has a relevance for the comparison of formulations and studies skin conditions effect. Its limitations are like higher variability, complex setup, because it requires the biological membranes like excised human or animal skin and the validated artificial membranes. Now we'll see the key differences between the IVRT and IVPT. IVRT purpose is release from the formulation to test the release, while IVPT purpose is to study the permeation through the skin. So membrane used in IVRT, these are generally synthetic, while for the IVPT, biological or validated skin membranes are used. IVRT is a QC quality control test, and it detects the formulation changes. It is used for the formulation optimization before the IVPT, while IVPT is to predict in vivo absorption. IVRT data is a release rate and the release extent. For IVPT, the permeation rate and permeation extent is measured. IVRT is comparatively simple and is reproducible compared to IVPT, while IVPT is more complex and variable. Both these tests are very important for the topical formulations development. So which test to use? Use IVRT or IVPT? So IVRT is used when you are going to assess the drug release from the formulation, and if you are going to compare the batches or formulations, and also for optimizing the formulation for the consistency. Then IVPT is used for predicting skin penetration and systemic absorption, assessing effect of skin conditions and evaluating the clinical relevance. Both these tests are required to be understood in much detail. I will be making elaborative and in-depth video on IVRT and IVPT after some time, and in those videos we will learn IVRT, IVPT in much depth. This is a introductory part to IVRT and IVPT for the topical formulations, quality control and evaluation. Many of the times regulatory authorities ask IVRT and IVPT. For some of the formulations, IVRT and clinical studies are required. For some of the formulations, only IVRT can suffice the requirement. Conclusion of the IVRT and IVPT is that IVRT is a formulation centered test. It measures the drug release, while IVPT is a skin centered. It measures the penetration. Often used together for complete understanding of the topical formulation performance, drug release and the permeation. This is regarding the IVRT and IVPT. We will meet soon with another videos on in-depth understanding about IVRT and IVPT. Thank you for watching the video.